the next topic that I'm going to talk about is asepsis, antisepsis, disinfection, and sterilization. So, what is asepsis? So, asepsis is basically, in general, the term or the technique that is used to prevent, not to kill off any like additional bacteria or anything like that, but to prevent the cross contamination by taking certain measures to prevent the cross contamination. And some examples of this can include things like, for example, using gloves or washing your hands properly. Um, so by taking certain measures like sterilization. So if you sterilize something, right? Then this is a type of aseptic technique. So aseptic technique is the general umbrella term. Okay, it's like it consists of all those terms, and and yeah. So basically, when you have all these terms, then that is when you have asepsis. So if you use like autoclaving to clean your devices, for example, or you use gloves or you use drapes. All these things are aseptic. So next is antisepsis. So what does antisepsis mean in this term? So the term antisepsis means that. So what is antisepsis then? Well, antisepsis is the process where there is uh, microorganisms and we're trying to kill the live ones, especially the live ones, but it's not possible to kill off any spores or anything like this. Also, antisepsis is a process that we use, especially on our skin and mucosa, in order to disinfect. So, what is the difference between disinfection and antisepsis? So, so the main difference is that there's disinfection. Disinfection refers to the process where you um, remove or kill any um, microorganisms that's multiplying and trying to invade you or trying to form colonies. While in antisepsis, it's the process of reducing the number of bacteria. So I'd say antisepsis is less severe or less destructive towards microorganisms in comparison to like things like disinfection. While yeah, disinfection is a little bit more stronger. However, disinfection still does not remove any types of spores or anything like this. And so this is one of the differences that could be noted. So what are some common organisms that's present within our skin? So we have things like coagulase negative, staphylococcus, or staphylococcus epidermidis, or aureus. These are the organisms that's present within our skin. And yeah, these are usually aerobic organisms. So then, if you're gonna, so for antisepsis, right, you should wash your hands first with soap, and then use, for inert surfaces. Inert means that whatever you put on it, it will not react chemically, so there's no chemical reaction due to the elements or the nature of the element within the surface. So in these inert surfaces, you should use things like acid alkali disinfectant, which are high potency, meaning that it can kill a lot. On more delicate but still inert non-reactive surfaces, use less corrosive oxidizer as well. Finally, for skin and stuff, you have to use weaker alcohol and oxidizers like that. So like iodine and stuff like that is going to be used. So next I want to talk about disinfection. So in disinfection, this is a case where we will try to remove as much dividing organisms as possible and stop the division and invasion and to make it less infective. So in disinfection, it does like remove some of the organisms as well, but So there's different types of disinfectants that we can use. For example, you have alcohols like ethanol or propanol, which are mainly used for hands. These are usually combined with water to increase its effectiveness at killing these microorganisms. Phenols are also used. These are more toxic, and its uses are limited on just surfaces and not on humans. We can also use chlorides. Chlorides are basically substances which are used in drinking water, bathing water, this kind of thing. And it's also used for wastewater treatment and textile. Well, oxidizers are some examples of oxidizers which are used are things like hydrogen peroxide, which are used for superficial wound cleaning, and trying to reduce the amount of bacteria on mucosal surfaces. Aldehydes such as glutaraldehyde and formaldehyde are used. These can even inactivate things like spores. Like I mentioned earlier, we have these aldehydes, like formaldehyde, glutaraldehyde, and yeah, so these are very strong oxidizers, which can even inactivate things like spores, and therefore it's used to disinfect surgical instruments like gastroscopes, endoscopes, uh, and instruments for ERCP, and also you can also use things like iodine. Iodines are basically used to disinfect your skin. So also another oxidizers. So you got iodine or bromide. These are betadine, and you can use it to disinfect mucosal surfaces, hands, wounds. The problem is that it may burn the wounds, and some people may be actually allergic to these. While others may complain of the brown coloring of iodine, which people may, preferably not use. And there's certain things like chlorhexidine. What is chlorhexidine? Chlorhexidine is basically something that you use. Uh, this is a cationic solution. So what's the difference between an oxidizer and a cationic solution? So oxidizer means that it gives off oxygen molecules, right? Well, uh, well, cationic solution, on the other hand, will other methods that can be used are things like acids and alkalis, which are types of bleaches. So these are not really intended for human uses. And other examples include organic dyes. Boric acid can also be used for antisepsis of mucous membranes. Like I said, there's many other examples as well. And finally, we can move on to sterilization. So this is the killing off all the dividing microorganisms as well as the spores and viruses. So some examples of sterilization methods that are used in hospitals include things like um, moist heat or dry heat. In moist heat, we use very high temperature steam, which are put under pressure, and this is called autoclaving, and it's very effective and reliable. It's fast, and it takes 20 minutes at 120 degrees Celsius at 2 to 3 atmospheric temperature, or sorry, atmospheric pressure, and we can autoclave glass, textile, metals, and fluid, and any other material that can tolerate humidity. And it's especially used in surgery, and in order to prevent the spread of prions, which causes Creutzfeldt-Jacobs disease and other cooler diseases, there are other special requirements needed to kill off these prions. And thermophilic spores, on the other hand, yeah, so there's like a thing where you can literally you can control the pressure of the tank, and as a result, yeah, whatever is inside this tank will be able to sustain or withstand the high increased level of humidity, and then it will effectively be able to sort of cure, or not cure, but like kill off all the bacteria. And so the higher the temperature, the higher the pressure will be. And there's also dry heat, and in dry heat, it's basically incinerating, so it's using a flame until the equipment becomes really red, and the temperature is around 180 to 200 degrees Celsius for 1 hour. For and Dry heat is actually has a limited suitability due to high temperature a long time, um, because if it's used on things like glass, ceramics, metals, then it starts to melt and actually sort of lose its form, and they actually destroy the product. So that's one problem that can happen, and it's not used for textiles, rubbers, and plastics, obviously, because it will burn and combust. Next, I want to talk about chemical sterilization. So, so what are some of the chemical substances used in the process of sterilization? So, um, some of the methods that are used in this process is ethylene oxide gas. So, so in ethylene oxide gas is used for materials that are too sensitive in high temperatures, especially above, not especially, so the threshold for the ethylene oxide gas is actually 60 degrees or higher than 60 degrees, um, or it's sensitive to humidity, like things like fabrics, etc., or other machines that you can't put into the fire or high temperature because it will break. And um, however, ethylene oxide gas is actually very toxic and also very explosive and volatile, so it's used with caution. And then we also have formaldehyde vapor. So this is used in conjunction with steam at 60 to 80 degrees Celsius, so lower temperature than autoclaving or dry heat under 90 kilopascal pressure. It only affects certain surfaces, and uh, so sometimes we mix the chemicals with carbon dioxide to reduce its volatile nature, inflammable, explosive nature, and also we can also use radiation. So the radiation that's going to be used in this condition are things like gamma radiation. So gamma radiation is effective for non-organic materials, and the radiation dose that's used is 25 kilograys. Uh, Also, cobalt is used. What is cobalt? Cobalt is the emitter of the radiation, which is radioactive, and it's also used in many industries. Ultraviolet radiation is used for surfaces and transparent objects, and is most effective at 260 nanometers and can be used to sterilize operation rooms between operations. And so, if you have ICUs like intensive care units, then VC labs are used. Uh, yeah, so these are used in heating and cooling systems like air cons and those filters that sterilize the air using things like laminar flow, this kind of thing. And air filtration is also used using ultrafine membrane filters. However, it's not really used in hospital. It might be used in quarantining people, but again, it's not really effective. And finally, boiling under pressure, which is also not very popular, and it um, destroys microorganisms, but not the spores. And non-infection means um, the whatever surface or contact location has the lowest possible pathogenic load. And yeah, so that's what it is. That was some examples concerning so disinfection, sterilization, and antisepsis in surgery.